What is the link between AFib and ischemic stroke risk? Imagine your heart beating irregularly, like a drummer missing a beat. That's what happens in atrial fibrillation, a common heart rhythm disorder. This irregular heartbeat can cause blood to pool in the upper chambers of the heart, especially in the left atrial appendage. When blood pools, it can form tiny clots. If a clot breaks loose, it can travel through the bloodstream and block a blood vessel in the brain, leading to an ischemic stroke. People with atrial fibrillation face a much higher risk of stroke compared to those with normal heart rhythms. In fact, their risk is about 3 to 5 times greater. Studies show that around 15 to 25% of all ischemic strokes are linked to atrial fibrillation. The risk becomes even more significant as people age. For example, in those over 70, the chance of stroke increases, and in people older than 80, more than 40% of strokes are associated with atrial fibrillation. The type of atrial fibrillation also matters. Paroxysmal atrial fibrillation, which comes and goes, carries a lower risk than persistent or permanent atrial fibrillation, where the irregular rhythm stays longer or all the time. Structural changes in the heart, like an enlarged left atrium, can also increase stroke risk, even if blood thinners are used. To prevent strokes, doctors often prescribe blood-thinning medications called anticoagulants. These include warfarin and newer drugs known as direct oral anticoagulants. These medicines can cut the risk of stroke by about 70 to 80%. Managing other health factors like high blood pressure, diabetes, and heart failure is also crucial. Regular checkups help doctors tailor treatment plans to each person's needs, reducing the chance of a stroke. In summary, atrial fibrillation causes the heart's upper chambers to beat irregularly, which promotes blood clot formation. These clots can travel to the brain and cause a stroke. The best way to lower this risk is through blood thinners and controlling other health conditions. Always consult a healthcare professional for personalized advice and treatment options.